If you're on a Medicare Advantage plan, don't just let it renew automatically this year, because what was great in 2025 might not be the best choice in 2026. Plans change every single year: benefits, copays, drug coverage, even which doctors are in network. So before you roll your plan over for next year, here are 3 things you must check to avoid higher costs or losing your coverage altogether. And by the way, if you'd like help reviewing your 2026 options, call the number below or use the link in the description to book a free Medicare consultation with us. So check number 1. This is the first thing you should check and one of the most common reasons people run into problems. Every year, Medicare Advantage plans renegotiate their doctor and hospital networks. This means your doctor or specialist who's in network this year could be out of network next year, and they might not even let you know about it until it's too late. When this happens, you could be on the hook for hundreds or thousands of dollars in out-of-network costs, or not be covered at all. So what's the best thing to do? Always check your 2026 provider directory to see if your doctor's in network for 2026. That provider directory is provided by your Medicare Advantage plan, that you can request it to be sent to you, or you can check it out online. You could also call your doctor's office and confirm that your plan is still in network for next year. If not, review other options or consider switching to a Medicare supplement plan for nationwide access. Check number 2, review your prescription coverage and copays. The second thing you must check is your drug coverage, because formularies and copays and tiers change every year. Now, it's a little bit easier now that the donut hole's gone and the max out of pocket is $2,100 for your copays for your drugs, but you need to make sure that your drugs are actually covered by your plan's formulary. In 2026, we're seeing more Part D drug plan changes, even on the Advantage plans. So we see some big name medications being taken off the formularies and not being covered at all. So it's extremely important, if you're taking anything branded or expensive, to make sure it's on your plan's formulary for 2026. And you can do that easily on Medicare.gov, or call your agent or your carrier and see if your drugs are covered for next year. Check number 3 is to check the 2026 out-of-pocket maximum on your plan, on your Medicare Advantage plan. So this one surprises a lot of people. Your plan's maximum out-of-pocket limit can increase every single year. And even if your premium is still 0, your maximum out-of-pocket can go from $6,000 to $9,000. In 2026, we're seeing a lot of plans in the $9,000 range for max out-of-pocket, which is a bit scary. So make sure you're aware of your maximum out-of-pocket going into next year. And while you're checking your maximum out-of-pocket, be sure to check your copays for your doctor, your specialist, emergency room, skilled nursing facility. Pretty much you want to look at your annual notice of change letter and see what's different from this year to next. I made a video the other week about how to review your annual notice of change. I'll put that link in the description below. Be sure to check that out if you want to know how to review your annual notice of change letter. And lastly, you want to watch out for plan terminations this year. There's a lot of carriers reducing benefits and canceling the plans altogether. So a lot of PPOs are being discontinued for 2026. And if your plan is ending, you'll get a letter from your insurance company, but a lot of folks are getting so much mail during annual enrollment period that they throw it out. So you need to manually check that your plan's available going into next year. You can call us, we can check for you, or you can check on Medicare.gov. But either way, you want to make sure your Medicare Advantage plan is still available next year. So to recap, before you let your Medicare Advantage plan renew for 2026, make sure you confirm your doctors and hospitals are still in network. You want to check your prescription coverage, and you want to review your out-of-pocket maximum and any benefit changes, because even small differences can add up to thousands of dollars next year. And as a bonus, make sure your plan is renewing in 2026. If you have any questions, give us a call at the number below. We'll be glad to help you out. And don't forget to click like and subscribe to stay updated on all things Medicare. Thanks for watching the video, and we'll see you on the next one. Thank you.